Hey everyone, this is the OSCE station version of the Vertigo episode.
We had Becky, a 77-year-old female, presented to the hospital ED department complaining of dizziness.
Okay.
What would you ask on history?
So the first thing I'd want to do is I'd want to ask Betty what she means when she says she's feeling dizzy. Is this kind of like a sensation, like the room is spinning around you, or do you feel lightheaded? And just kind of vaguely like maybe you're even going to lose consciousness. Have you ever had anything like this before? I'd also want to ask, how long is this kind of dizziness lasting? Is it lasting like 30 seconds or is it lasting like hours? Has it been days? If there was any kind of any precipitating factor, so things like, were you recently hit in the head? Have you recently been unwell with like a viral illness? Have you noticed that it occurs when you're kind of getting out of bed and moving your head around? And then I want to go on to assess some associated symptoms. So things like, have you had any changes to your hearing? Do you have any tinnitus? Do you have any sense of like ear fullness? And then I would also want to screen for kind of more red flag type symptoms like strokes. So have you had any slurring of your words? Have you had any kind of weakness in your arms or legs? After asking about them, I'd also want to ask, have you had any past medical history? For social history and someone of this age, you'd also want to ask about their ADLs and whether or not they're driving.
Yeah. So you've conducted your history. Betty says that she gets this dizziness whenever she gets up out of bed, and then it lasts for 30 seconds and then disappears entirely. She hasn't had any recent sickness and she's got no ear symptoms at all, or chest pain or neurological red flags. What would you do on examination?
So I would begin just generally observing Betty. Then I would take vitals. And most importantly, because this patient seems really suspicious of BPPV, I would do a Dix-Hallpike to confirm this. Be a positive test if she was to have a sensation of vertigo or if she was to have nystagmus during the examination. Yeah, so you'd want to then also just briefly auscultate the heart, check and see if there's any other stigmata of cardiovascular disease or neurological disease, so any stroke signs.
In regards to a general observation and vitals, they're all normal. And you've done your cardiovascular and neurological exams, which are both negative. So you've done your Dix-Hallpike test and that's come back positive. So do you order any investigations? And if so, what investigations would you order?
Since this is a pretty straightforward case of BPPV, I wouldn't be thinking any investigations would be necessary.
How would you manage this patient?
To manage this patient, what I would do is I would educate them about their condition, explain that the way to kind of resolve this is to do something called an Epley's maneuver. After consenting them, the patient's symptoms have resolved. I think it would be important to safety net before discharging them. So telling them if this does recur or if they do feel any other kinds of signs of like neurological or symptoms which make them concerned, to return to the ED or to their GP.